Hello, ma'am. Am I audible? Hello, ma'am.
Hello, madam. Is it audible, madam? Is it audible, madam? Madam, your voice is not audible. No, ma'am, you are not audible.
Is room ಸಿಗುತ್ತೆ ನೀನು ಮತ್ತೆ ಅವಳು ಸಪ್ರೇಟ್.
Hello, ma'am. Am I audible? You are not audible, ma'am. Your voice is not coming, ma'am. No, ma'am. Still not coming. Hello, ma'am. Still not audible, ma'am. Hello, ma'am. You are not audible, ma'am.
Hello.
Yes, ma'am.
Yeah. So I have connected to my mobile. Is it okay? I think
Yes,
this
ma'am.
is echoing.
Keep mobile up from left.
Okay.
ಶೇರ್ ಮಾಡಕ್ಕೆ ಮೇಡಮ್ ಅದನ್ನ PPT ಶೇರ್ ಮಾಡಿದ್ರೆ ನಾವು
Yeah. Hello.
Yes, ma'am.
Yeah. Hello.
Yes, ma'am. You are audible now.
Okay. Oh, yeah.
Shall I start?
Everything is okay right now?
Yes, ma'am. Can you share
Okay.
your screen, ma'am?
Yeah. Yeah. I will. Okay.
Okay, ma'am. Shall I start, ma'am?
Yeah. Yeah. You can start.
Okay. Good morning to one and all. Myself, Dr. Tushar Jani, first year PG scholar from the Department of KAYACHIKITSA, with the blessing of His Holiness, Shri Manipra Guru Mahant Swamiji, on behalf of Department of PG Studies in KAYACHIKITSA, organizing KAYACHINTANA 2021 National Webinar Series 4, I welcome you all. Now I request Dr. Venkatesh, Assistant Professor, Department of KAYACHIKITSA, to give welcome speech. Over to you, sir.
Dhanvantari Namna. Very good morning to one and all who gathered in this platform. So it's last day of our national webinar series Kaya Chintana 4. So today I welcome our madam, today's guest speaker, Dr. Yasmeen Phaniband madam, Professor, Department of Kaya Chikitsa, DGM Ayurvedic Medical College. So madam going to explain you the clinical approach to the Khalithya and Ayurvedic perspective. So I welcome you madam. Over to you, the moderator.
Thank you, sir. Now I request Dr. Prabhu, first year PG scholar, Department of KAYACHIKITSA, to introduce our guest. Over to you, Dr. Prabhu.
Thank you, Dr. Tushar. Good morning to all. It's my great opportunity to introduce today's honorable guest speaker, Dr. Yasmeen A. Phaniband, Madam. Madam has completed her undergraduation from DGM Ayurvedic Medical College, Gadag, in the year of 2000. Madam has completed her post-graduation from same college, DGM Ayurvedic Medical College, Gadag, in the year of 2004. Madam worked in the PG department of Panchakarma for 4 years. Madam guided more than 20 PG scholars in Panchakarma and KAYACHIKITSA department. Madam have 20 years of clinical experience in the field of Ayurveda. Madam has interested in the field of research and treatment of cosmetology, skin disorder, GIT disorder, and neurological disorder. Madam presently working as a professor, Department of KAYACHIKITSA at DGM Ayurvedic Medical College, Gadag. Thank you. Thank you, madam. Over to Dr. Tushar.
Thank you, Dr. Prabhu, for the introduction. Now I welcome ma'am and requesting you to start the session. Over to you, ma'am.
Yes. Thank you, Dr. Prabhu. Very good morning to one and all present here in Kaya Chintana National Webinar series organized by SVMVV Sanghas Shri Vijay Mantesh Ayurvedic Medical College and Postgraduate Research Center ILKAL. So my deepest salutations to Param Pujya Guru Mahant Swamiji, respected Principal Sir Dr. K.C. Das, President of today's event, Organizing Chairman Dr. P.V. Joshi Sir, Organizing Secretary Dr. R.V. Yadvannavar, Co-organizer, my students Dr. Venkatesh and Dr. Praveen Sajjan. I congratulate you all for conducting such a webinar series for our students and our physician community. A very good job in imparting knowledge and keeping students in touch with the subject virtually. I wish all the organizing team from Department of Kaya Chikitsa for your next endeavors. Wish you all the very best. And thank you, Dr. Prabhu and everybody for welcoming and making this session for me to conduct. Okay, so shall we start?
Yes, ma'am. You can share your
Okay.
screen.
Yeah, okay. Just a second. I hope the screen is visible and slides are being shared.
Yes, ma'am. Everything is okay.
Okay, yes, okay. So my topic in today's virtual session is about clinical approach to Khalithya and Ayurvedic perspective. So today we are going to have a brief perspective of Ayurveda, how we are supposed to approach to patients with the most commonest complaints of this Khalithya Roga in today's scenario. Okay, so coming to the introduction, so as we know in today's corporate life, okay, prime importance is given to our appearance, our personality and beauty. So our face is the mirror of our personality, and that should be maintained from the what hairstyle we keep. So that is also very important because our hairstyle also gives a very good look to our face. And if we have a very good hair structures and dense and good hairs, then we can make any type of hairstyle to give a good appearance to our face. So that's why hair plays a very important role, and this hair keeps our face and our personality beautiful. So healthy, beautiful, long and attractive hair, they really add charm to our personality. But nowadays what happened, the hair loss is quite common in both males and females. Okay, so according to one survey, up to 40% of men and 25% of women in India are victims of hair fall. So this is the present scenario, how we are supposed to know the totality and the um, you know the chances of getting this one and the prevalence rate, and how many patients in male and female are suffering with these conditions. If you are experiencing sudden or unexplained hair loss, that is more than 50 hairs per day, then we can diagnose this condition as hair loss. Many times our patient comes and complain with the notion that many hair falls are there. Okay, so how to judge? Regularly, with the help of our phases like telogen, anagen, and catagen phases, every day we are losing our hairs. But if the number of hairs, if they exceed more than 50 per day, okay, then we can diagnose this condition as hair loss or hair fall. Okay, so here we are naming this word as Khalithya, or in general we are calling it as baldness. So this baldness is commonly seen in the age group of 18 to 40 years, but nowadays hair fall is common in youngsters too. Okay, so hair is the first noticeable part of our body for women as well as for men. Even minor changes in hair, like the graying of hair, early hair fall, they affect the self-confidence as well as self-esteem of an individual. Next slide. Though hair fall or Khalithya comes under Kshuddra Rogas, so which is affecting approximately 1.7% of the whole population. And this is a very challenging task for physicians to diagnose and to treat. Okay, so here Khalithya in younger age nowadays is increasing rapidly. In this age, an effective as well as a long-lasting treatment is the need of the hour. So this is how our adolescent, our teenagers, they come to our OPD with the complaint, and this becomes a very challenging task for us to treat the condition. Okay, so here hair fall is a physiological phenomena if it occurs after the mid 40s, but it is considered a disease if it arises earlier. As we know, this jara, as by the concept of jara, after 40s or our mid 40s, one start losing their hairs. But if the condition occurs before to that age or at the age of teenage, then this is a very great cause for our concern. Okay, among four types of Ayurveda has described, Sukhayu is the four types. Okay, so this Sukhayu is of important deal, that is one is living without physical and mental disorder and having qualities like Bala, Virya and Parakrama and Saundarya. So this is a very important aspect of one's Sukhayu. So under the headings of four aspects of our criteria of our Sukhayu, this beauty or the Saundarya is also a part. If we don't have beauty or we don't look good, then mentally or sometimes physically we feel embarrassed and we are not under the heading of Sukhayu. So here hair is a barometer of one's beauty. Okay, so to look good, our hair must be very good. That will also impart some beauty to our body. Okay, so coming to the incidence, if you see the incidence, the overall incidence of alopecia is approximately 20.2 per 1 lakh persons per year. And the prevalence of alopecia or baldness, it ranges from 0.1 to 0.2% depending on the geographic location and ethnic backgrounds. And this alopecia incidence appear to increase almost linearly with age, but the mean age of onset appears to be between 25 to 36 years. This is what nowadays we are facing. And androgenic, especially not only in male but even in females also, we are observing androgenic type of alopecia, which affects about 60% of men throughout their lives and probably 25% of women. Next. Okay, so coming to the description of this Khalithya in our classical review. So we cannot get a very direct reference of this Khalithya from one Samhita. So this is a collection how best we can have the compilation of this Khalithya to understand this disease very better and to treat by adopting different principle concepts from different Samhitas. Okay, so among the Brihadris, Sushruta Samhita and Ashtanga Hridayam, they have described Kshudra Roga in separate chapter. So if you just recollect what are the Kshudra Rogas, then you will come to know these two authors, they have explained about this Khalithya under the heading of Kshudra Rogas. Next, in Charaka Samhita, though it is a very good textbook for KAYACHIKITSA, but here there is no direct mention of this Kshudra Roga separately. After Madhava Nidana, Bhav Prakasha, Sharangara Samhita and Yoga Ratnakara, they have also elaborated the chapters on Kushtarogas. Okay, so under these heading only, we can get some description about Khalithya. Almost each and every Kshudra Roga, what they have explained by the Acharyas, is near about similar except for few variations. Okay, and there are some variation in the terminologies of some Kshudra Rogas, whereas in others, symptoms may be changed a little bit, while in rest of them the treatment varies. So this creates some sort of confusion in the students community, how to understand and how to get the subject of Khalithya to be compiled to study. Okay, so in Charaka Samhita, the disease like Khalithya has been included in Urdhva Jatrugata Rogas. So that is under the heading of ENT. We can get lots of information about this under the heading of this ENT. Vagbhatacharya has also described this Khalithya in Shirorogas under the heading of Urdhva Jatrugata Rogas, and these are further subdivided into 9 Kapalagata Rogas, where you will get one description out of these 9, you will get the description of Khalithya. And Acharya Charaka and Ashtanga Hridayakara have included Khalithya as said earlier, Shiroroga on the basis of Rogasthana and Nidana of the disease, which is similar to that of Shiroroga. So based on the sthana or based on the place from the origin of the place, these two acharyas have classified. And it is very clearly mentioned in Ashtanga Hridaya that 9 disorders or 9 diseases which are occurring on the outermost part of the head. That is, what is the outermost part of the head? That is the scalp. So over the scalp, whatever the diseases are occurring, that should be called as a Shirogata Rogas. So among these Shirogata Rogas, our Khalithya also comes. Okay. So here Sushruta, Yogaratnakara, Madhavanidana have included Khalithya under the heading of Shudra Rogas on the basis of their less severity and the mildness of the disease. Okay. Kshudra, the very name suggests that it is very alpa or very small. The nidanas are very alpa. The lakshanas are very few, and even they are not worrisome for the physician to treat. Okay, so commentator Gayadasa of Sushruta, he has commented that there are minor. Why they are minor? So to say they are minor or they are Kshudra, they are minor because of their littleness of their in terms of causes, in terms of symptoms and treatment. and they are not only minor but also means a terrible, which though of a few low stature frequently gives prick and pain and embarrassment to the person. So that's why it is called as Shudra Rogas. Okay, next slide. So we can see this Khalithya again in different context, how to understand. To treat the disease, not only a mere reading or compilation of the disease from Samhitas is enough, but at the same time we are supposed to go in the depth of the subject to understand. So we can see the description of this Khalithya in different contexts. Like the very first context, what I personally read and what I personally treat for my patient is Dhatu Pratoshaja Vikara. So in Charaka Chikitsasthana 28th chapter, Charaka has very elaborately described about Dhatu Pratoshaja Vikara. So when dhatus are provocated very extremely by the doshas, then it causes respective dhatu pradoshaja vikaras. It may be rasa pradoshaja vikara, it may be rakta pradoshaja vikara, or it may be asti pradoshaja vikara. So under this context of pradoshaja vikaras, dhatu pradoshaja vikara, our asti pradoshaja vikara is one, and this is explained for chikitsa visheshaha. The very important part for explaining this is for chikitsa vishesha vijnanartha and sukha sadhatvadi karma bodhanartham. So the purpose of saying this is regarding good prognosis and better understanding of chikitsa or better intervention. So these are the reason to explaining the dhatu pradoshaja vikara separately by Acharya Charaka. Okay, so as per Yogendranath Sen, the Kesha, Loma and Shamshru are malas of asti dhatu. And this is the reason to consider Keshadi doshas as one among the asti pradoshaja vikaras. So how we are incorporating this concept of so the asti dhatwagni during its process of metabolic conversion into majja dhatu produces prasada bhaga to majja dhatu. So during this process, the
Hello, ma'am. You are not audible, ma'am.
arts or the kit.
Ma'am, your voice is breaking, ma'am.
Yeah. Is it audible now?
Yes, ma'am.
Yeah, there was a call, that's why it was disconnected. Okay, we'll continue.
Okay.
So many times we get confused to understand the prasada kitta avastha of uttarottara dhatu utpatti krama. So here the doubt always get revolved around which dhatu prasada bhaga nourishes which one, and the same doubt applies to the kitta bhaga too. So for this reason, Chakrapani, while commenting up on the Grahini dosha in Chikitsa, okay, he explains. What he explains? Prasada bhago utpadam abhidhaya malabhago utpadam maha kittam ityadi rasasya kafa iti rase pachyamani kittam kafa bhavet prasadascha raktam. So he has given, or Chakrapani has given one example of prasada bhaga or of rakta. So what he says, the kitta or the residual part or the byproduct, it get produced only after the prasada bhaga get produced completely. Here he further clarifies, quoting an example with rasadhatu, that kapha is the kitta bhaga of rasa. It means that after completion of a pachyamana avastha of dhatu agnipaka, the kapha as a residual or as a byproduct, it get produced. So in the meanwhile, the prasada bhaga produced during the process of dhatu pachana nourishes the uttara dhatu, that is rakta. So in this way, the uttara dhatu utpatti krama takes place. So based upon this dhatu utpatti tattva, enhancing or modulating the dhatu paka with dhatu pachika dravyas, especially that of asti and majja dhatu. That helps in increasing both the prasada bhaga, that is majjasya sneha amshaha, and the kitta bhaga, that is keshadayaha, is one mode of chikitsa that helps in managing the patient of Khalithya. So this is the a very important concept or understanding or the principle of treatment to know how best we are supposed to enhance the Dhatuvagni and how to rectify this Dhatuvagni Paka to get best outcome from our Prasada Bhaga. Okay, so this is how the importance of this Asti Pradoshaja Vikara is to be incorporated in our treatment. Okay, next one. Coming to the brief physiology of our hair. Okay, so in Ayurveda, Kesha is described as Mala, we know. So among all the 7 dhatus, every dhatu undergoes transformation by Dhatuvagni Paka, and it forms a main product and a byproduct. So in this sequential process, the Asti dhatu produces 2 parts. That is, one is Sara Bhaga and the second is Kitta Bhaga. So that we have already quoted from these references. Okay, so along with the production of Uttarottara Dhatu, there is side-by-side production of Upadhatu also. So this Upadhatu is nothing but what? The secondary tissue, and Mala of former Dhatu or the previous Dhatu. So during the process of production of Dhatu, when the metabolism of Asti Dhatu occurs by its Agni Majja Dhatu emerges, and from the Sara Bhaga, and at the same time hair of scalp and body, that is Roma and nails, Nakha, forms as Mala. So this is what the Mala concept as well as the Upadhatu concept. So according to Acharya Sharangdhara, scalp and body hairs are the Upadhatus of Majja Dhatu. So here when we are treating or when we are adopting the Chikitsa principle, we should not forget the Majja Dhatu, because once we rectify and clear the Majja Dhatu, automatically the Upadhatus can also be upgraded or they can also be rectified. So among all the Garbhaja Bhavas, hair is Pitraja Bhava. This in terms of structure. Okay, so all these bhavas, okay, so these bhavas in terms of structure, color and quantity of progeny are dependent on the paternal side. So that is said in Charaka Sharirasthana, 3rd chapter. So hairs are mainly of Parthiva Mahabhuta, and they become, because it is, as we know, this Parthiva Bhava is always Guru in nature, and it is Ruksha because of heaviness and this Rukshata, these qualities. So here we can consider the heaviness means insolubility. Okay, if you dissolve hair, they will not get soluble. So that is what the Guru Tattva in our hairs. And the nutrition of fetus is by Upasneha, that is exudation, and Upasveda, that is conduction of heat. So this Upasneha is through hair follicles only. So in the time of during the fetal growth also, a fetus growth takes place from the hair follicles only. Next comes to the Keshotpatti. So this occurs in 6th or 7th month of intrauterine life. Okay, so here hair is, again we are considering hair is made up of a hard protein called keratin. So the same protein that makes up the nails and outermost layer of skin, and this can be divided into 2 parts, the root and the shaft. So here hair roots grow from tiny pockets on the scalp known as follicles. As the base of the follicles lie the papillae, which contains the blood vessels to supply and give nourishment to the hair. So this is most important aspect to understand in our pathology and to rectify the same one. Okay, so here hair shaft has 3 layers. One is cuticle. So we are considering this cuticle as a transparent outermost protective layer, this medulla as a innermost layer, which is mostly absent in the scalp. Okay, and third part is the cortex. So the middle layer, which provides strength, color and texture to the hair. So this is a very small description regarding the hair. Next, Kesha Sankhya. If you just see number of hairs, how many numbers? Okay, so total numbers of human hair is 3.5 crores. So Acharya Charaka has described that there are 29,956 Kesha which forms and the Shamshru and Loma in the body, which are equal to the number of Dhamani Mukhagras. And according to Vidyotini Tika of Charaka, the number of hairs stated by Aptopdesha is 72 crores. And according to Sushruta, there are mainly 4 oblique dhamanis or Tirek dhamanis, which are Romakupa, which are having Romakupa and are responsible for the drainage for Sneha and Sweda. So according to this statement, one can believe that there are innumerable hairs of the body. So we cannot predict, but somehow we get this sort of description in terms of Kesha Sankhya. So here, in the same physiological aspect, if you consider what is the physiology of this hair, so hair has the function of protection and regulation of body temperature. Okay, and one more statement we can say is a normal human human being have approximately 1 million hair follicles on his body, of which 1 lakh hair on the scalp. A hair normally grows at the rate of approximately 1 centimeter per month, but each hair grows in 3 cycles. So every hair has to undergo certain cyclic phases. The first phase, what we are calling, that is anagin. So this anagin is the growth phase, where the growth of the hair or the hair follicle takes place. Next, the catagen phase. This is the transition phase. From follicle, it erupts and it will transit to the hair parts and hair. And the third phase is telogen phase. So this phase is the resting phase, where there will be no falling, there will be no growth. But after certain period, for example, a period of 3 years or a period of even 10 years, our hair cycle again start growing in terms of again anagin, catagen and telogen. So one more quotation I have got. Acharya Sushruta said that Drishti and Lomakupa, they all never grows throughout lifetime, but our hairs and nails, they definitely grow. So this is how best we can get the hope of regenerating or regrowing these hair follicles and hair. Okay, so this is one concept we can understand here. Next, coming to the Vyutpatti or etymology. Okay, so here in Shabdakalpa Dhruma and Vachaspatyam, they have mentioned Khalithya as Khalati, Khaliyanti Keshaha Asma. So the literal meaning of this word Khalithya is falling of hair. So Khalithya is a disease in which the hair fall occurs in various forms, that is either completely or incompletely, but sometimes it is prematurely. Okay, Khalithya, the reason to say is if it is falling prematurely, then we are considering it as a Khalithya. Next, synonyms of Khalithya according to different acharyas. So Khalithya we can come to know with the different synonyms. Okay, so Khalithya by Charaka and Sushruta, Khalati by Ashtangakara, and Chacha again Ashtanga Hridaya, Indralupta, Bhoja, and Keshagna, Harita Samhita, and Ruhya, again Bhoja and Sushruta and Ashtangakara, they have given as Rujya. So all these are different synonyms. Okay, and apart from these synonyms, we are coming across with different terminologies like a Kesha Patana. So Kesha Patana always implies for hair loss, and Indralupta. So this is alopecia areata, where a patchy hair loss will be there. And Khalithya, that is baldness depending upon the involvement of the doshas which are accumulating in the process of our hair fall. Okay, so next comes the definition of Khalithya. So Charakacharya has mentioned that the Tejo Mahabhuta or the Tejas, by involving all the Vatadi doshas, when it covers up the scalp, it results in Khalithya. And Sushruta has given the prime culprit or the prime involvement of the Pitta dosha. So when Pitta dosha along with Vata dosha, by involving or getting into the roots of hair, that is Romakupa, this causes hair fall, and thereafter kapha or shleshma along with the shonita, it obstructs the channels of romacopa. So that is follicle, leading to the stoppage of the regeneration of the hair. And this condition is called as Indralupta, Khalithya or Ruhya. So this is the version by Sushruta. And Ashtangakara has differentiated Indralupta and Khalithya by saying that in Khalithya, loss of hair occurs gradually than that in Indralupta, but the pathology remains same in both the conditions. Next, coming to the Nidhanas. Okay, so here to have a very better outcome from our treatment, it is very essential to evaluate and elicit all the Nidhana factors from our patient. So here common Nidhanas, as we can incorporate and we can gather from our samhitas, like a Vega Dharana. Okay, generally we know this Vega Dharana or separation of our natural urges, what they cause. They generally causes Vata Vriddhi and they causes Udavarta like conditions. So here Vega Dharana is the most important causative factor or Nidana. Next, Abhinga Dvesha. Okay, so those who are having grudges against massage, those who do not apply massage, those who do not apply oil on their scalp, in them also the hair fall will be more, prevalent. Next is Ama. As we know, undigested or semi-digested materials, if they remain for a prolonged period in our body, then they will result into such conditions. So Rajaha, Dhuma, and Athapa Sevana and Hima. So one who is continuously exposing to all these factors and exposure to frost at night. Those who are having the habit of walk at the night and exposing to the frost. Okay, and Prajagarana, Diva Swapa, Shitambu Sevana. So the use of very cold water regularly, those who are taking. Okay, next one. Okay, and Ati Maithuna and Pravakta, the facing headwinds, and Asatme Gandha, inhalation of unwholesome odors, and Manahastapa, mental afflictions, mental worries, and intoxication with alcohol, and excessive weeping or Rodhana, and Uchchar Bhashana, talking too loud. Vagbata has given this one. So because of all these conditions, okay, all these Nidana, what happens because of all these Nidana, the Ushna Guna of Pitta Dosha in individual, of especially in Pitta Prakriti, they start, hair fall and graying of hairs will be very earlier than individuals of other Dosha Prakriti. So this is one reason why if you do excess of warmth, okay, some acharyas, they have given the importance of what happens if our body is start getting conserving more amount of heat. Okay, the hair has tendency to lose its natural color with advancing age. Although aging is genetically predetermined, but lifestyle, our dietary habits, our mental status, our social status, our family life, and many other environmental factors may influence the aging process, and their unfavorable effect results into causing premature aging. Okay, in one survey, in a survey study, 81.66% of patients of premature graying of 30 to 40 years age uh, had complaints of hair fall. And premature aging could be because of increasing hair fall in people. So this is also one reason how these premature graying or hair fall are inversely proportional to each other. If you have a problem of premature aging, automatically the tendency of hair fall will be more and vice versa. So here the causative factors of Shiroroga, like as Vagbata has explained separately, like too much exposure to smoke, okay, sunlight, mist, indulgence in water sports, excessive sleep or avoiding sleep, okay, and getting direct breeze, drinking water and alcohol, that is wine. He has very specifically given drinking water and wine in large quantity and presence of warm in large. Okay, if our body is conserving lots of heat inside it, then the appearance, suppression of the natural urges and avoiding all this, the use of pillows, always looking downwards, and unaccustomed, unhealthy or vitiated or smells, or taking raw smells too much and speaking excessively. So all these causes, and by indulgence in these and similar causes, the doshas get aggravated and they produces Khalithya because of same place of manifestation. So this is the Samprapti explained by Bhagavata Acharya because of the place. Okay, Shakhagata. Okay, next he says as Dharunaka. So under the heading of this Nidana, we should not delete or we should not miss Dharunaka. So here Dharunaka is nothing but what? Excess of dandruff. If your patient is having, the complaints of dandruff, many times, along with the kapha and vata, this pitta gets, displaced, leading to Dharunaka. Here, kapha and vata causes minute fissures on the scalp, which are dry, and they show the signs of itching that results into hair fall. Okay, so here the Dharuna means hard. Okay. Next, very important aspect in the Nidana concept is the use of lavana, ati lavana. Okay, excessive consumption of lavana or salt and shara, they will also result into Khalithya. And improper diet or excess salt in diet consumption by pregnant lady causes Khalithya early in her child due to vitiation of pitta. Even during pregnancy, if a pregnant mother, a lady, is consuming excess of salt, that will affect her progeny. Okay, so this is the most important part regarding this one. Excess lavana intake or consumption, that is becoming a very foremost habit among people nowadays. Okay, we are using, we know this lavana is a best preservative. And to preserve our food, we are using lavana in excess. For example, in pickles, okay, to keep our pickle for a longer period in good condition, we are adding pickle. And the same thing, regularly, the use of pickles and excess of salty foods, especially our packet foods. Okay, so our all packet foods or our processed food, they are rich in lavana or salt to keep the food items in good condition for a longer period. Such type of food, if they are being taken in excess, what will happen? It very gradually affects our health. So Charakacharya has described the Ati Upyunjita Lakshanas of Lavana Rasa. He says if people are consuming excessive salt for a longer duration, definitely they will affect with the baldness. So this is the very good quotation by Charaka in the usage, in the excess usage of Lavana Rasa. Okay, since salt is associated with Ushna and Tikshna properties, if you just recollect and if you just see, it is Tikshna in nature, it is Ushna in nature. So it is neither very heavy nor it is very greasy or snigdha. So it is having, even it is having a rechaka or laxative effect. So this all attributes together results into early hair fall. Okay. So however, it is responsible for accumulation of doshas if not used properly. Okay. And according to this Bhagavad, other acharyas, we can consider some other etiological factors like viruddhahara. Okay, so viruddhahara, like a simultaneous intake of lavana with milk. So here I am going to take the only one example from viruddhahara, that excess of lavana along with milk, if it is being taken regularly in the diet, it induces Khalithya, and they are very prone to get baldness condition. And in many countries or many states of our India, we are seeing such habits of taking milk with lavana. So in Charaka Chikitsa Sthana, talking too loud and by ignorance of Pratishaya, this Khalithya occurs as a complications. So this is also one one reference I got. If you are ignoring your Pratishaya, then it may land up into some complications like in the form of Khalithya. Okay, and when talking about Kshudra Rogas, very few of Kshudra Rogas are described with some specific Nidana. So most of them are external causative factors. A very few are having psychological, while few indicates personal unhygienic habit. The main intention of quoting this one from Kshudra Roga concept is, see, our Kshudra Rogas have been described in terms of their psychological intervention, in terms of their short causative factors, and some of the Kshudra Rogas are there which are due to unhygienic effect. So here unhygiene, those who are not taking regular head bath, those who are not keeping their scalp clean and dry, and those who are not taking care That will also a nidana for getting hair fall or Khalithya. Okay. And some manasa bhavas. Okay, so psychology always imparts and impacts on our physical body and our makeup or our facial makeup or our look. So in this present stressful environment, disturbed manasa bhavas generally have some impact on our physical health, like excess of shobha, shokha, bhaya, krodha. Okay, different types of anxieties, different types of work stress. All these play a very major role in causing this condition. Okay, and this will definitely results into akhalaja. Okay, so early premature graying will be there. Okay, next one. So here Purva Rupas, as such we don't get Purva Rupas, okay, so appearance of some symptoms in a very mild form. So how our patient comes to us, in Samhitas we don't get the Purva Rupas for Khalithya and very specific Rupas, no, there are no such cardinal symptoms, only they are in very mild form, may be considered as a Purva Rupa. In this way, occasional loss of some hairs may be considered as Purva Rupa of Khalithya. Sometimes the symptoms may persist for a certain period and afterwards they will disappear, and automatically patient will not give importance to this Purva Rupa. Okay, so the cardinal symptoms of Khalithya is gradual loss of hair. Along with this cardinal symptom, various acharyas have mentioned some associated symptoms according to its type. How best we can judge the cardinal symptoms based on the types? We cannot have a direct Purva Rupas. For example, acharyas, all acharyas, they have classified Khalithya in 4 types. Vataja Khalithya. If your patient is coming with the symptoms of scalp condition where the Kesha Bhumi appears as it is Agni Dagda, okay, and it becomes Shava and Aruna Varna. So based on this color, based on the appearance of the scalp, we can understand that. So this is a Vataja dominant type of Khalithya. So similarly, in Pittaja type of Khalithya, the color of the scalp is Pita Varna, Neela Varna, Harita Varna, and it always comes with excessive sweat and with some greasiness over the scalp. Okay, so the color of the scalp is more or less same as the color of the skin, but here it is ghana and snigdha in appearance, and the color tends towards the whitish tinge. So in Kafaja. So in what happens in Tridoshaja Khalithya? So all the characters of the Tridoshas are observed, and the scalp looks like with the burnt, and it bears nail or pricky like appearances. So based on this examinations, or based on this appearance of hair, especially scalp, we can attribute the lakshanas to the doshas. Okay, here Acharya Harita has denoted this disease by the name of a Keshagna, and he has classified its symptoms according to its types, like Ruksha and Pandura scalp is there. So this Ruksha and Pandura scalp, they generally occurs due to Vata dosha. If it is very greasy, if the scalp is greasy, then this is due to Kapha dosha. And if it is associated with pus or puya along with rakta, then it is called as sannipataja, along with the symptoms of other doshas also. But some specific, for the prognostic sake, okay, to prognosis, for the purpose of prognosis, here sannipataja type of this Khalithya is considered as asadhya. So if the scalp is associated with pus and with some fistular eruptions, rakta, many patients, they will come with and they complain that some fistular eruptions have developed with itching and other things. So sometimes that may be very difficult for cure. Okay. Next comes sadhya and asadhyata. Okay. Here we come to the samprapti ghatakas. Okay. So for the better samprapti vichedana, it is very important to understand this disease in terms of our samprapti ghatakas. Here the doshas which is mainly involved is vata dosha, mainly samana vata and vyana vata. Pitta, pachaka pitta and bhrajaka pitta is associated. Kapha, mainly this tarpaka kapha. Dhatus or doshas which have involved here are rasa, rakta, asti. Malas like the sweda and keshamala. Agni, mainly Jataragni, Rasagni, and Asthyagni that we are supposed to incorporate and understand here. And Ama is always Rasa and Raktagata Ama. Srotas is Rasavaha, Raktavaha, Astivah and Svedavaha Srotasis. We are supposed to consider. Manovaha Srotas is also involved here. Udbhavasthana is Amashaya. Its Sancharasthana is through the Rasayanis or the lymphatic channels or Rasavaha Srotas. We can also incorporate here. Adhisthana is Keshabhumi. Roga Marga is Bahya Roga Marga, including Himarga. So that is Shiraha. So these are the very important aspects in this Vichedana of our Samprapti and better application of our treatment. Coming to Sadhya and Sadhya, they are considered as Sadhya, whereas Tridosha is always a Sadhya. And Ashtangakara has considered scalp when our scalp appears burnt, nail-like appearances, and having absolute hair loss because of injury, and because of injury also due to some burns. So here we are focusing as burns. So when all such conditions are there, then it is considered as asadhya. Okay, next, importance of hair in diagnostic. Okay, sometime we should not forget the concept of Arishta Lakshana also. Even to initiate our treatment and to say the good prognosis, some sort of Arishta Lakshanas can also be incorporated. So here, Acharyas have mentioned Kesha Launchana. So Kesha Launchana is nothing but what? Where your patient forcefully stretching of the hair is known as Kesha Launchana, where there is no pain or there is painless, scratching will be there. Painless, there is no pain of hair without any force, and it is one among the Arishta Lakshanas. So if you just pull up and if you just do the lift, the hair will very easily come out. Okay, and in unconscious conditions, when patient stretches the hair, is also considered as Arishta Lakshana. And suddenly increase of dryness and loss of luster in the hair is also considered as Arishta. And when our hair falls during Bhojana is one of the Purva Rupa of Rajakshana. And in many skin conditions, Loma Harsha. Okay, so this is a very important aspect we are supposed to consider in Pushta conditions and in Dushi Visha-like conditions, where your patient comes with Loma Harsha. Next, approach to the patient. So coming to the important aspect of our treatment, okay, before going to start our treatment, our approach of the patient is very important. Okay, so here, hair fall can be manifested as a primary disease or independent disease as well as a secondary to other disorders. So these can be present as a symptoms in many diseases. So here these three concepts we are supposed to keep in our mind whenever we are approaching our patient. One is primary disease, one it can be secondary disease, and third is as a symptom also. So as a symptom of many diseases. Okay, so because of its variable etiopathogenesis, we need a careful approach to the patient for proper diagnosis and treatment of hair fall. So here proper history should be taken, including all the criteria like past medical history, family history, and personal history, along with other general and systemic examinations. Okay, for that reason, here of course, we are supposed to do the general examination and systemic examination, whichever your patient is complaining of. But at the same time, scalp and body should be examined very carefully, since the place of origin and the site of the pathology is our scalp. So here, carefully, we should go on examining the scalp to detect any abnormalities in the skin. Okay, so here, Prakrita Kesha. Okay, so here Prakrita's three Kesha, how they should be? They should be Kunchita, curly, they should be Dirgha, long in length, they should be Krishna Varna, black in color, they should be very soft, and Naekamula with only one root, they develop from only one root, and Abhinna Agra. So undivided tips, that is what we say in our colloquial term as a slitted ends. Okay, so that should not be there. So this is what the description of our normal hair. Similarly, Vikrita, what happens when there is pathology? Hair becomes Kapila Varna, they become Phalitha, grade, or they become Parusha, Sthula, and Bahumula, and Sputitagra, and Atikutila, Vevi, or Risva. Okay, many times our patient generally comes with these notions and with these words, either split ends, short, very short hairs, my hairs are not growing long. Okay, so all these things should be incorporated in terms of our Prakrita as well as Vaikrita part of examinations. And coming to the Kesha Bhumi, so Prakrita Kesha Bhumi is always nirmala. It should be clean, it should be snigdha, it should be lohita varna, and it should be free from any vrina. Similarly, what happens when it is Vikrita? Vikrita Kesha Bhumi is always malina, it is ruksha, and it is durganda yukta. So all these things many times we miss in our general examinations. So it is very important for a physician to look and give importances to these things. So here durganda, malina. So if these things are being rectified at means by means of our nidhana parivarjana, then the cost of our medicine, the time of our duration of medications will be made shortened. So one should pay attention to all this prakrita as well as the vaikrita lakshanas in our patient. Okay, next coming to the diagnostic test. After doing all these things, even if we feel that some diagnostic interventions are important, then we can go for some of these things like at our OPD level, we can go with the CBC. Next, transferrin saturation, total iron binding capacity, serum iron, and very importantly, TSH level. This is very important nowadays because most of the female patients, they are coming with the, these thyroid complaints. So it is very essential to exclude our patient from all these hormonal, impairments and disturbances. So better to go with the TSH, total serum hormone level. So all these are very important, and very important examination or lab test is here is androgenic lab analysis of a DHEA. So this is a very important androsterone which is responsible for causing all these things. Okay, and biopsy of the scalp in later conditions, if you are suspecting some gross conditions, some anomalies, some different anomalies. So that time you can go with this microscopic examination of even plucked follicle. Okay, so this follicle can be sent for this biopsy and other trichoscopy and trichogram examinations. So these are the diagnostic tests which we can incorporate. Okay, next coming to the Chikitsa principle. The first Chikitsa principle we are supposed to initiate with our Nidana Parivarjana. So this is the very first line of treatment. Whatever the Nidanas are there, that should be omitted first. So they have to be initiated and they have to be omitted from the patient. Okay, and according to Charaka, Asthyashrita Vyadhis, okay, coming to the principles, we'll discuss about the principles, based on what principles we are trying to initiate our treatment. So this is very important. So Asthyashrita Vyadhis are treated by Panchakarma. So Charaka, while telling the treatment in Asthipradoshita Vikaras, he very briefly and precisely told about use of Panchakarma, especially by Basti, which is prepared out of Kshira, Sarpi and Tikta Dravyas. While commenting on Chikitsa Sutra, Chakrapani opines that Tikta, Kshira, Sarpi is a hita for Asthipradoshita Vikaras. So this is the first line of treatment we are supposed to incorporate in our principles. Okay, so here going with the Basti. So Basti is the best treatment modality for Vata and the vitiated doshas which are located below the Navi Pradesha. Here, the administered Basti reaches the Pakvashaya, which is the place of Purishadhara Kala. And Pakvashaya and Asti are the main seats of Vata dosha. Therefore, increased or decreased formation of Vata affects all the sites of Vata, especially the Asti. Hence, the Purishadhara Kala is also considered as Astidhara Kala. So, this invariably nourishes the Asti also, especially Tikta Sadhita Kshira Sarpi Basti. When it is indicated in Asti Pradoshaja Vikaras, this Tikta Rasa has predominantly Vata and Akasha Mahabhutas predominant. And as per Aruna Datta Tika, this Tikta Rasa has a unique property to maintain the Kharatva of Astidhatu. So Kshira and Sarpi has predominantly Prithvi Jala Mahabhuta and Madhura Rasa Yukta. So these properties will check the vitiated Vata dosha, and the provocation of Vata will result into Asti Dhatu Dushti. So So Basti is the best treatment explained for Vata dosha. So the Tikta Rasa in combination with the Sneha Dravyas in the form of Sarpi and in the form of Basti have twofold action. One, it provides a sufficient nourishment to Asti Dhatu, and it also checks the pathology of Vata dosha. So that's why we are supposed to plan this treatment, that is Basti in that is Panchatikta Kshira Basti. So this Basti is very fruit yielding method in treating our Khalithya disorders. Okay, so in Vangasena has described a common line of treatment for Kshudra Rogas. So I'm telling the line of treatment of Kshudra Rogas, so that can be applicable because this Khalithya is also said in Kshudra Rogas. So Vangasena has mentioned the line of treatment like a Shastra Karma, Shara Karma, Agni Karma, Lepa, and Shronita Shravana. So here Rakta Mokshana. So this is very important line of treatment. This can be incorporated based on our need. Okay, and various Bahya and Abhyantara Chikitsa is described for Khalithya. Most of the research studies we are seeing nowadays are on Nasya, Rakta Mokshana, and external application in the form of Lepa. Okay, next coming to the concept of a Kesha. So here the word Kesha is suggestive of Keshaya Hitam Yattat, means that which is good for health. And this Kesha concept can be understood by three perspectives like a Kesha Sanjanana. Kesha Sanjanana means that which helps in the origin of hair. Second, Kesha Vardhana, that which promotes hair growth or which makes hair dense and thick. Third is Kesha Ranjana, that which gives dark black color to the hair. So most of the drugs what we are supposed to take in our Shamana or in our application form should have these properties. So whenever we are planning, for the treatment of this Khalithya, the concept should come to our mind is about Kesha, and these Kesha concept is having these three perspectives. Okay, next treatment plan. How one we can plan for the treatment. So first is Pachana and Dipana is very important. Snehana Svedana. So this all depends on the yukti of the patient. So that's why yukti Vipashya Chikitsa. Okay, so that can be planned based on the symptoms, based on the conditions, based on the feasibility of our treatment, and based on the availability. Okay, so here Pachana Dipana, Snehana Svedana, Panchakarma, Nasya, Basti, Dhumapana, Shirodhara, Rakta Mokshana, and Rasayana Chikitsa. So among all these treatment modalities, we can take some of the steps and we can plan our treatment. So all the things I have incorporated here. And Ekamulika Prayoga, single drugs. So whenever being a KAYACHIKITSA person, it is very important to plan and to give results from our a Shamana treatment in the either in the form of oral medication or in the form of this application. So here we can take many of such drugs. So these drugs like Vibhitaki, Yashti Madhu, Bakuchi, Bhallataka, Gambhari, this Nirgundi, Gunja, Neeli, Bringraja, Shreyaka, Japa, Bijaka, and Tilak. So these are having some specific sort of Kesha properties, as well as they have certain properties which will directly help and penetrate to the follicular region of the hair. Okay, so if you just go through some of the drugs like Vibhitaki and Haritaki, okay, so these are having some of the drugs like the Chedani and Vedani action. So what we require to break the pathology in our Khalithya is to does the Chedana to clarify or to remove the Srota Dushti. So that is by means of this Chedana and Vedana action we get from such drugs. Okay, so here Shamana Chikitsa. Coming to this Shamana Chikitsa, we can have this Saptamrita Loha. Okay, we can have Asti Poshakavati, Arogya Vardhani Vati. So this is the combination of all patent as well as our classical medicine. Some of the rasayanas like Nasimha Rasayana, Agastha Haritaki Rasayana, Kanakarishta, Vipanchamuladi Grata, Amalki Rasayana, Navaya Saloha, Pandura Bhasma, and everything. So this is all based on the yukti of the patient. So why these drugs I have selected is, for example, Saptamrita Loha. So this Saptamrita Loha, as it is said, in all Urdhva Jatrugata Vikaras, very simple. We should not scratch our head when it comes for the prescription. So the Saptamrita Loha is mainly advised in all Urdhva Jatrugata Vikaras, very simple. And this, as this contains Loha, okay, so this Loha or iron, this balances our Pitta dosha, and this is the best source of our iron. If you are having this sort of interpretation, then there will be no dilemma in selecting this thing. And second, for example, this Asti Poshakavati. So what this Asti Poshakavati, this mainly contains our Kukutanda Tvak Bhasma, it contains Asti Shrinkla, it contains Arjuna, Ashwagandha, Guruchi, Bala, and so on drugs. So if you are giving these, yoga for a period of 2 months or 3 months or 6 months, then that will rectify this Vata dosha, and it is a very best source of calcium supplementations. So in this way, if we are planning our treatment protocols, then definitely our patient will come with the good outcomes. Okay, apart from this, Kasisa Bhasma. Okay, so this is also having a very good Kesha property. So for Ranjana Karma and for growth. Okay, so this Kasisa Bhasma, next Narsimha Rasayana. Okay, okay, so they are also having Kesha properties, Rasayana properties, as these Rasayanas nowadays are very rich in phytochemicals, and they contain vitamins which are very good for our health. So here, again, one more line of treatment according to Acharya Charaka has mentioned Khalithya Chikitsa Sthana 26th chapter, and stated that first Vamana and next Virechana therapy has to be done. Okay, then Nasya treatment has to be adopted, and then oil for massage, massaging hair and scalp should be given to the patient. So he mentioned for these purposes Vidari Gandhadi Taila and Tiladi Yoga for local applications. So we should not deviate. What I personally suggest you is, everything is there in our Samhitas, everything is being explained by our Acharyas. Only the thing is, we need that perspective or mindset to read that particular quotation and to follow. So in my practice, I generally use this Tiladi Yoga. If I'm not getting this Tiladi Yoga, simple Tila Taila is very good for this local application. Okay, and Vidhari Gandhadi Taila, Desmodium gangeticum. If this taila is being applied locally, then this taila is having many good properties. And along with this, Jati, Karanja, Varuna. Okay, so all these can be applied in the form of paste, and it can even be used for Abhyanga and Udgharshana. And later, Rakta Moksha is also good therapy in Khalithya. Okay, so next comes some of the applications. As I said, Bringraja Taila. Okay, very commonly this is very easily available in over the counter, or even at our OPD hospitals. We can get this Bringraja Taila. So this Bringraja Taila is having the actions of both Kesha as well as it is best Kesha Vardhaka. It is having the Rasayana and Kesha properties. Okay, so it is having Katu, Tikta, Rasa, Laghu, Ruksha Guna, Mushna Virya, Katu Vipaka, and these properties like Rasayana and Kesha properties, they also act as a Amapachika and Srota Shodhaka. So in the Falashruti of this Bringaraja, it says that in Falita, in Khalita and Indralukta and in Sarva Jatru Urvagata Rogas. So this is indicated. So without any choice or without any dilemma or second choice, we can go with this Bringraja Taila for application, simple application or abhinga in all such conditions. And very commonly, Narikela Taila, that is our coconut oil. So this coconut oil with its Guru, Snigdha Guna, Madhura Vipaka, Shita Virya and Pitta Shamaka and Kesha properties, this relieves Vata Pitta and helps in the nourishment of hair. So generally, if we are using simple Narikela Taila, then it is good for our hair. Next, how to have a hair care. So before starting, of course, we are prescribing some of the medicines orally, internally, as well as for external application. But at the same time, if you advise the patient with some of the cares which they can take or do at their own setups. Okay, so here first is a Murdha Taila. So Murdha Taila is nothing but what oil should be regularly applied on the scalp. This prevents falling of hair, prevents baldness, and it also makes our hair black, long, and deep rooted. So this provides nourishment to the hair follicle, and it also gives strength to the cortex and shaft. For this reason, coconut oil or mustard oil can be regularly used. So based on our geographical conditions. So we at this belt area, we are using coconut oil very frequently. So in the northern side, this mustard oil can be applied in the hairs. Okay. Second is nasya. So everybody should take a single nasal drop of Anutaila every year during rainy season, autumn and spring season when the sky is free from the clouds. So what happens? This prevents hair fall and also accelerates the growth of hair. So in our Rutucharya, it is already said, okay. So in such Rutus, if we are doing this Anutaila, even if Anutaila can be regularly done, okay, with a few, 1 or 2 drops regularly, then it nourishes the hair follicles, it strengthens the hair, and at the same time, hair fall can also be reduced. And third important thing is snana. So Acharya Sushruta has mentioned that the head and hair should not be washed with very hot water. How our snana should be? Neither it should be very hot or it should be very cold. So pouring of very hot water reduces the strength of hair and eyes. So proper hair wash should be done at least 3 times in a week with mild herbal shampoos. And here we are restricting the use of soaps and other chemical or detergent based shampoos and other things. Okay, so mild, simple, gentle or mild herbal shampoo is necessary to keep our scalp clean. Okay, for that decoction, any decoctions, okay, we can prepare some decoctions at our home. So decoctions made from our herbs like japa, like henna, like shikakai, jatamamsi, and even simple trifla and this soap nut, okay, bringraja, musta, brahmi. So these can be used for simple or regular hair wash. So this can be prepared. Okay. Next is dhumapana. So medicated smoke for good sensory function. Okay. Since our sensory organs are situated in the shirastha, so for this purpose, this medicated smoke or this dhumapana relieves and it clears the doshas from the shiras or the shiromadas, and that will again improve the firmness of hair on the head, beard, and teeth. So this is as said in the context of dhumapana. Next comes the Kshaura Karma. Okay, so regular hair cutting, proper care of the hairs of scalp, beard should be done regularly. So here Charaka Acharya has mentioned everybody should have a haircut, shave, and nail cut thrice in every fortnight. Okay, so this is the version of Charaka, how best we can keep ourselves by means of this Kshaura Karma. And next is Ushnishka. So Ushnishka is nothing but what? Wearing a turban or a good cap on head. So this protects our hair from wind, heat, dust, and other things. And this also gives a very pious and a very gentle appearance to our body, and it is very beneficial even for our hair. And this also protects one from getting bad environmental effects or factors. And next is leech therapy. So Vagbhatacharya has quoted that the application of different types of pralepas should be performed after doing prachanna or suchi karma to get the very best outcome of our lepas and other things. If you are doing simple suchi karma or prachanna karma and later you are advising your patient to go with the lepa, then you will get a very good result out of your applications. Next is Virechana karma. So here Virechana karma, I'm not advising you to advise your patient to go with the regular Virechana. But if you are keeping your patient on Nitya Virechanas by simple Abhyadi Modaka, by simple Swadishta Virechana Churna, so that will keep the bowels always regular and clean, and thereby the deposition of the pathology, the deposition of the dosha and the mala will be very minimal, and that will be very good for the disease. Okay, next is Rasayana Karma. So here Rasayana Prayoga. So Shruta has advised Rasayana Chikitsa in Khalithya Chikitsa. So here Rasayana drugs acts as immunomodulator and they help in reversing the aging process. So the best Rasayanas like Amalki Rasayana, okay, Swadamshradi Rasayana, and some medicated oils, and even some rasayanas like Agastya Haritaki Rasayana. So all these rasayanas can be incorporated for a longer period to get the best immunomodulatory effect, and medicated oils for local applications. So all this, so Bringraj Tailam, Chitrakadi, Irimedadi Taila, Gunjalipa, and Hastidantimasi. Of course, they are very rare to get all these things, but with simple, our Bringraja Tailam, with our Narikela Tailam, with our Chitrakadi Tailam, and Irimedadi Tailam. So these are the most tested and trusted applications in hair problems. Okay, next comes, we should always first, very important thing is harsh chemicals. Okay, and many times we used to dry our hairs with the help of these dryers and other things. We use many harsh chemicals. So all these things, harsh chemicals, heating treatment used in practice for cosmetic purpose should be avoided, or they can be very minimally used. Okay, so many times we used to go to the parlor and other things, and we are subjecting our body, our scalp, and our hairs to all these harsh things. So better to use them in a very minimal amount, and better to avoid. Okay, and some yogasanas are also incorporated in our daily life, like Shirshasana, Shavasana, and Bhramari Pranayama, Anuloma, and Viloma Pranayama. So these types of yogasanas, they will affect our CNS, our cardiovascular system, and especially our thyroid gland. So these asanas, for example, our Shirshasana. So it increases blood flow in the brain, and thereby it directly nourishes the brain and hair. So in this way, we can make our protocol to treat our Khalithya patient at the optimum level. Now, again, these pathyas, after treatment, these pathyas are very important. Okay, what thing to be incorporated in our food, what thing should be avoided. So this is very important thing. So we should always advise our patient to go with the protein-rich diet. So our acharyas, they have also advised the same pathya, drugs like a Godhoma, Yava, Shali, Mudga, okay, Kushmanda, Patola, Kaharavellaka. So these are all a very good source of phytochemicals, nutrients, okay, and micro minerals. So all these things can be incorporated from our daily food intakes. Okay, like tomatoes, onions, okay, and tilataila and coconut oil, even for external as well as for internal use. So this can, if we are using coconut oil, okay, in our daily routine cooking, then that can also help to get rid all these complaints. Okay, amalki, dadima, okay, mustulunga, amrafala, narikela, kadalifala, okay, draksha, and all things should be incorporated in our food as fruits and other things. Okay, next, Padarakshaka, best hygiene for hair. So Padarakshakas, so as we have known that there are some relation with our scalp, with our soles of foot. So if we are using a good Padarakshakas, then definitely, and Pada Abhyanga also, so that will definitely nourishes the innervations of our nerve, and that directly connected with our head and scalp. And eat protein-rich diet. So this is a very important thing we should advise to our patient, that we should always take a protein-rich diet. And apathyas, like we should always avoid apathyas. So here excess quantity of lavana, as we have discussed, this ati lavana, okay, is responsible for causing baldness. So ati lavana, excess quantity of lavana, amla and katurasa pradhana dravyas, and shara sevana, okay, and continuous use of fried diet. So all these things should be omitted from our diet chart. And polished rice, mamsahara, polished rice, viruddha ahara, vegetable ghee, that is what vanaspati ghee or dalda, what nowadays we get in our food, which we are eating from outside. Okay, in home, I think nobody prefer to cook our food in dalda, but the food what we are eating from outside outlets, they are generally made with this dalda or vegetable ghee. So that is most incompatible and most nidhana janaka factor in our baldness. Okay, so vidahi ahara and sulfur dioxide and ahita jala and all the nidhanas mentioned above to be avoided. And here, don't use mobile or any electronic gadgets before 2 hours of sleep. So this is also very important. Nowadays we are habituating with all these, we are attached with many electronic gadgets like our laptops, like our smartphone and other things. We are talking, we are chatting, and thereby we are sleeping there itself, keeping our mobiles or gadgets at the very near side, either at the top end or at the bedside of our sleep areas. So better to avoid all these things, to get the bad effects of these radiations. Okay, next one. So with this, our conceptual idea of this Khalithya is over. Now I would like to share very few cases of the case studies of Khalithya. Okay, so in the slides you can see, so a 25-year-old male, okay, suffering with excessive hair fall along with the dryness of the scalp and itching since 1 year. He visited, okay, he had having this complaint since 1 year, visited our DGM OPD with the OPD number. I will share with the case sheet. Case sheet is also there in the slide. He experienced hair fall, itching and dryness since last 1 year. Gradually, he developed excess hair loss from the scalp, like baldness. And then he underwent some mental stress due to this hair loss. And afterwards, he approached many allopathic treatments, but that gave him no result. With these complaints, he approached to our OPD. So when we took the past history, there was no relevant past history of fever and other things. Many times when we are suffering with some chronic illnesses like typhoid and other fever like chronic fever, generally we complain of a very short transient period of hair loss. So it is very important to take in the history that whether your patient has suffered with such conditions. Okay, and family history. So no member of the family had the history of such illness. And when we took the personal history, patient was a vegetarian, appetite was very good. He used to sleep 6 to 7 hours with a very sound sleep. Bowels were irregular. Here, the bowel habits were not corrected. It was irregular. Maturation was okay, normal 5 to 6 times per day and one time at night. And addiction, as such addiction is concerned, no addiction was there in this patient. And we done with the Ashtasthana Pariksha. This Ashtasthana Pariksha was also normal. There were no any changes. And when we did the general examination, all the general examination was also normal. And investigation, hematological investigation of the patient was within normal limits. And this case was diagnosed as Khalithya on the basis of signs and symptoms. And patient was treated at OPD level with the intervention, like we used to give in the intervention Deepanapachana. So as we have said in the Chikitsa principle, okay, so Kayasya Antaragni Chikitsa KAYACHIKITSA. So when we are treating, when we want to treat our patient without taking the help of any Panchakarma and other thing, then we should be very precise about the Samprapti Ghatakas and analyzing all the Sampraptis, analyzing the Ama and analyzing this Agni level of the patient and everything. So based on all these things, Deepanapachana is very important. So here Deepanapachana, Agni Tundivati was given 1 BD, Amapachika Vati was given 1 BD, and Gandharva Hastaditala. Since the patient was having irregular bowels, so I just put this patient on Gandharva Hastaditala 10 ml along with milk. So this intervention was given for and after 7 days and Swamla compound. Okay, so Shri Guru Papesh was the Swamla compound was advised to the patient 10 grams along with milk. Okay, so along with this for application Haritakyadi Churna with Gomutra. So this was given to the patient daily. It has to be applied in the morning. Haritaki Churna, simple Haritaki Churna with Gomutra. And Karanjadi Taila was advised. So since Karanja is the best Kesha, it is best antifungal. Okay, it will check all the pathology related to our scalp. Either it could be fungal infection or any sort of follicular infection and other things. So this Karanjadi Taila was advised daily at night. Okay, next slide. So this picture is of 0th day. So when patient came on 15th day, okay, so he started getting some of the hairs. So how the on 0 day the scalp was very empty, it was very clear, and after application and after taking all these medicines, so the picture is of 15th day. The same treatment was continued for another 1 month. On 30th day, okay, so on 30th day, patient developed these many hairs on the scalp. And what happens for 1.5 months, the patient was on this line of treatment, but suddenly because of this lockdown and this thing, he couldn't approach. But later patient approached on fourth month. So on 4th month, the same condition was there. Patient was in touch with me on phone call, and that same treatment was advised to the patient to continue with the same treatment, same application. No changes was made were made, and this was continued for another some months. And 4th month, patient approached me, and these were the photos. So here, what I mean to say is, with simple line of treatment, okay, with simple history taking, nidana parivarjana, and our yukti, okay, the yukti vyapashara chikitsa will definitely help in treating. Okay, another one case is of, so this is the case sheet. Okay, so here I have given asti poshakavati, I have given, okay, and this is the case sheet. Okay, next one. So this is another one case of Indralupta. So as we have discussed Indralupta, this also comes under the category of our Shirogata Roga and related to our health. Okay, so a female patient, 36 years, sorry, 42 years female patient came with patchy hair loss. Okay, since last 2 years, it gradually increased and covering frontal area, occipital area, parietal area, and temporal area of the scalp. And occasionally itching was there on the scalp. Okay, and there were no relevant past histories and other things were noted. So intervention I did was the same intervention I repeated with this patient also. Deepana Pachana was given, and a simple Mrudu Shodhana was given, and Karanjadi Taila. So patient was having some sort of scaly or scaling was there. So I just cleansed the hair initially, because many times this Indralupta is a cause of fungal infection, and many times our patient take lots of antifungals and they become resist. Okay, for that reason, scalp treatment is very important. So scalp treatment, how we do with simple wash. Okay, we do some mild herbal media to cleanse and keep the scalp first. This is most important thing. Okay, so here I did this Mrudu Shodhana with the same Gandharvastadi Taila, and Karanjadi Taila was advised for this patient for at least 15 days. Patient was go on applying this Karanja on the affected part as well as on the scalp every alternate night. Okay, and later Trifla Shirolepa was given. Trifla. So here I use this Trifla Churna along with the Gomutra. So this Trifla Churna mixed with Gomutra and applied or rubbed at these areas of a patchy hair loss. Okay, so this is the first line of treatment, and along with this some Shamana medicines, same Shamana medicines were also given. Next. Okay, so later, so these are all the progressive photos of the patient. So this is during treatment. Okay. Okay. After 1 month of the treatment. So because of lockdown, patient couldn't approach for a few days, but patient came on 6th month. Okay, but this treatment was continued. Okay, Trifladi Churna or this Trifladi Churna Gharshana. What I used to say is Trifladi Churna Gharshana. I used to ask the patient to rub these, this Churna along with Gomutra. So this was, the thing. Next is. Okay, all the patchy, areas will were filled with, hairs. So this is the very simple treatment. But the thing is, consistency is very important. You should always instill confidence in your patient, and you should be very thorough. You should always ask your patient to have a very good follow-up and see the results, how the things are going with the patient. Okay. So another one case I want to share is of Khalithya. So this is a girl of 11 years. Okay, the case sheet I will share with you. 11 years old girl. She approached with her parents for early graying of hair. So here no history of hair fall was there, but in the treatment, she underwent lots of treatment, and she met a number of physicians for the complaints, but they were not happy with these complaints. They approached in the year 2019 July to our OPD, and when I took the personal history, was almost normal, nothing was there. And the very important thing I want to assess in this patient was rasa, because the concept we know that whenever such premature things are happening with us, very immediately we think of about rasayanas. Okay, so what are the rasayanas here and how the rasayanas are act here? So for that reason, I went for some intervention. I took the investigation in the patient, like the very first thing which is commonly available at our OPD level investigations, like so here I did, before starting this treatment, I did this CBC and total protein. Since we talked about protein is the building block of our body and it also nourishes our cells. So that's why I took the total protein in the patient. So the total protein was just 3.2. The slide is visible. It was 3.2. Okay, and the HB was 9.2. Okay, and all the other blood parameters were also low. Okay, so with this concept, I just thought about giving rasayana to the patient. I was not ensure the patient that the hairs what they have grade will be blackened. No, but the hair which will grow further, so that can be that can be made into new black hair. So this was the thing, or this was the confidence I instilled in the parents as well as in that girl, and then I started with the treatment. Okay, so here with this blood investigations, I started with Deepanapachana, same with Agnitundivati and Amapachakavati. So this concept I never forgets in treating my patients. So do Amapachana and do Deepanapachana. So Swadishna Virechana was also given for the Koshta Shuddhi, and Neeli Bringa Taila was given for application. So this Neeli Bringa Taila along with coconut oil was advised weekly thrice. Okay, and later a hair wash was also advised with very gentle and mild herbal shampoo, which was available at our counter. Okay, and later rasayana treatment was added. So here rasa level is very low. When I examined the skin, the scalp, and all the rasa lakshanas were appreciated, they were all in low level. So I planned this rasayana therapy. So Agastya rasayana along with milk, 10 grams. BD with milk was given, Astiposhakavati was given, and Raktab capsule, a patent medicine Raktab capsule was given. And after a few months, okay, the patient approached with the same complaints. The complaints were there. Patient's hairs will not get blackened. Okay, and even the hair fall was also not there. But after taking these medicine, the general condition of the patient, the appetite was improved. Okay, and the performance of the student, that girl was improved. And again, after 3 months, I rechecked this one, the same levels. They came to the protein which was 3.5. It became, see, you can see the protein became 6.3, and the HB which was just 9 point something, it increased to 9.7%. So here I have not added any of the extra protein supplements and other things. Only with this Ayurvedic line of treatment, and diet was also advised to the patient. Pathya and apatya was very strictly advised. Patient was very well habituated with taking processed food and other things, counter foods, okay, and packed foods. So that was completely and restricted and advised not to give to the patient. And later it was like this. Next one. And later again the protein came to normal. It was 3 point something, and after a few months of therapy, you can just check the dates and other things, 6.5, and even the HB level grows to 9.9 gram per DL. Here, the patient was absolutely free from any of the modern intervention. No ferrous, no calcium, and no protein supplement was given. With these, rasayanas, and with these simple advices and nidhana parivarjana. Okay, once you leave the nidhana parivarjana, automatically the things will set right. And this photo was taken after 8 to 9 months. And because of lockdown also, the patient did not approach to us. And but meanwhile, the same treatment was going on. The same application of Bringa Neela was there. And I inquired the mother of this child whether she is getting new hairs from the fallen areas. So mother was very happy, and she told that the new hair which is growing is not in white color, but it is in black color. So this is how, with one line of treatment, okay, with one line of treatment and with one line of principle, we can manage such group of conditions. So this is how. Still more things are there, but because of short period of time, I'll just like to conclude with the conclusion that what we know here, samadosha. Okay, our common concept is samadosha sammagnischa malakriyaha prasannat mindriya manah swasti iti bhidiyate. Okay, so with this concept, always we should not forget this concept to remember. So this concept here, as we have seen that samadosha. So what are our doshas here? Here our doshas are vata dosha like our vyana vata and samana vata, and our pitta like bhrajaka pitta, and our kapha like tarpaka kapha. So this should be rectified here. This should be corrected. Samadhatus like rasadhatu, medodhatu, astidhatu, and majadhatu has to be corrected here. And samagni, that is our main jataragni, as well as our astidhatvagni has to be corrected. And malaha, like this kesha, roma, kriyaha, okay, and are the malas of our asti that should be made in normal. Okay, so of these, okay, after doing all these things with our line of treatment, they lead to a healthy state, that is state of good health. So as today, okay, due to various changing lifestyles and other things and some disturbances in our routine life, we are coming across with lots of stress and other things. We can correct them by following the dinacharya, rutucharya, ratricharya, and sadvrata palana. So by this, we can keep all such problems at bay. So this is a very simple line. With this line, I would like to conclude that if we are advising our patients to follow simple these charyas, then automatically, and sadvrata is also very important to get rid from the psychological disturbances. Okay, so this is the very best thing our acharyas have said. Okay, so with this, I thank one and all. I would like to thank the organizer for giving this opportunity, the team of KAYACHIKITSA department for conducting such series, Principal Sir, Dr. K.C. Das. Of course, if you are hearing me, I would be very grateful for you for giving this chance. Okay, thank you one and all. Hope this session is useful to you all. Now over to the moderator.
Thank you, ma'am. Thank you, ma'am, for sharing your knowledge with us. Ma'am, some questions are raised by audience. Can I discuss,
Okay.
ma'am?
Yes, yes.
The first question is, ma'am, what are the chances of occurrence of Khalithya according to gender ratio?
Repeat once again. What are the chances?
What are the chances of occurrence of Khalithya according to gender ratio, ma'am?
Gender ratio. As I discussed, in females, the male ratio and the female ratio. Okay, male and female. Male are very prone to get this badness or Khalithya. So, for 60% of male and 25% of female are prone to get these conditions. Okay, and that too, teenage, our adolescent or are getting this early or premature graying. So in both men and women, but the ratio in men are very high compared to women.
Thank you, ma'am. The next question is Khalithya can be genetically inherited?
Of course, this is what I said. This is genetically predetermined. Okay, Okay, if our parents, or if our siblings, or if such history is there, then the chances of getting this Khalithya is predetermined. But based on our lifestyle, based on our modifications, and based on the exposure to the etiological factors, this can be well modified. Okay, I'm not saying that if our parents are suffering with these conditions, then of course we would also suffer with the same condition. No, but if our lifestyle is being modified, okay, if we are not undergoing with the nidanas, if we are under the influence of some rasayanas, if we are taking some nitya rasayanas, okay, regularly, then the chances of getting this one is very less. Okay, so that's why rasayana therapy, if you just recollect the Dasha Kshayas, as Sharangdara has said, Kshaya, our body always undergo under the process of aging. Okay, so that aging can be stopped at the earliest. Okay, from 0 to 10 we are losing our childhood. Okay, from 11 to 20 we are losing our intelligence and other things. So if during such decades, if we are switching on to some of the rasayana therapies, then the chances of getting that could be very minimal.
Thank you, ma'am. Next question: how stress affects the hair fall?
How?
Stress affects the hair fall.
I'm not getting you.
How stress affects the hair
Stress.
fall?
Yes, how stress affects the hair fall. Okay. See, generally what happened, as Charaka Acharya has already mentioned, that excess of warmth, excess of temperature, if it is being conserved inside our body. So what happens in the stress process? If you are undergoing a regular episodes of stress and anxiety, the energy or the heat what our body is generating will be conserved inside. And this excess conservation of energy, that is what in terms of temperature, will result into the increase of pitta dosha. And pitta dosha generally have the tendency of early aging, early graying, and early falling. So we have to take care of this excess of energy or warmthness should not be get conserved inside our body. And at the same time, the food, okay, the food what we are taking in excess, if our food is very rich or very high in pitta vardhaka, okay, all these pitta vardhaka aharas if are being regularly taken, for example, all these chilies, spicy food, and the food made in excess of oil and other things, so all these food prepared out of these spices, if they are being taken in excess, then what will happen? Again, our pitta dosha is increased, and that pitta will directly helps into the excess conservation of energy inside our body, and thereby the chances of getting this hair fall is very high. So that's why one should keep. Okay, so pitta is always responsible for this graying and it's a falling. So if you are keeping your pitta, if you are keeping all your stress level, if you are very well versed with your psychological or your you can handle your emotions very well, then automatically the stress level can be minimized, and you will be under the no worry of getting this hair fall.
Thank you, ma'am. Ma'am, any role of Shirodhara and Khalithya treatment?
Yes, Shirodhara can also be incorporated. Okay, as Shirodhara, when your patient is coming with complete baldness, okay, or some sort of hair fall, if you are advising this Shirodhara, so definitely that can. The action of Shirodhara, we know that it has got a local action. So local action, it will the nerves which are innervated in the scalp can be re-stimulated, and thereby the follicles and other obstructions will be get clarified. And especially what I advise, or what I think is, in pitta prakriti person or those who are under the high influence of stress and other thing, okay, if they are taking this is takradhara not only having the effect of only regeneration of this thing, but this takradhara generally calms and it soothes our psyche or manas. So thereby once you are mentally calm and you are composed, with your stress, then automatically the pathology, or if the pathology is related, or the hair fall is due to some psychological intervention, that can be obtained, and that can give a very good results. So I do agree that even for Takradhara have also a definite role in treating this.
Thank you, ma'am. Ma'am, next question. For Darunaka, any Kriya Kalpa is there as per your experience?
So as such, Kriya Kalpas are concerned, since I belong to this KAYACHIKITSA, I take every patient as a challenge to treat patient only through my Shamana Chikitsa or through my applications. So in a very few conditions where it is completely indicated, Panchakarma is indicated, where Kalpas are indicated, as you said, this Kriya Kalpas. So that Kriya Kalpas are always having some sort of indications. Unless and until your patient doesn't have that sort of indication, I don't send the patient for these Kriya Kalpas. But you can go with the Pichus also. Okay, so I have seen some result, but the result was not that much satisfactory. Okay, with the help of these Kriya Kalpas. But in general, in my practice, I don't go with these things, Kriya Kalpas as you mentioned, but a simple Abhinga, Shiro Abhinga, and cleansing is very important. And internal pathology, unless you are not rectifying or reversing the internal pathology, then the external therapies outcome will be very minimal, or it can be delayed. So in my advice, for even for very chronic conditions of Darunaka, okay, I take the help of simple Taila Abhinga. One is cleanser and one is Abhinga. Even I am not advising the patient to go with the regular application of oils. If they are applying the oil twice or thrice in a week, then it is very important. Because what happens if you go on applying this oil, and if your patient is not maintaining the hygiene what he has to maintain, then automatically, so that will again clog the follicles, and they may responsible for aggravating the conditions. So here in such conditions, we should always keep our scalp clean, and it should be very dry. Okay, and herbal shampoos should be used, and regular this thing application. Okay, and food and etiological factors should be deleted.
Thank you, ma'am. Ma'am, last question. What are the herbal shampoos you advise for excessive dandruff?
See, that depends on the availability of in the market or in the area what. But generally, I preferred at our OPD level some patent medicine I used to go with, because they are very easily available. See, one thing I strongly suggest that our patient should not roam for the medicine here and there. Okay, okay. Some counters, some medical counters, they keep some medicine, and some of the medicines will not be available. So we should always practice within the reach. So I prefer Kumari shampoo. Okay, so this Kumari herbal shampoo is very gentle, and I think this is of a Prakriti remedies. So this is very gentle for the scalp, and at the same time, Etrimate companies Scalpel lotion I generally use. Okay, within 2 or 3 washes of this Scalpel lotion. So this comes in the lotion base. Okay, this is not even shampoo. So I just advise our patient to undergo every alternatively or based on their required. Okay, or their usage. So this Scalpel lotion can be applied during our head bath, and it has to be cleansed and rubbed with our fingertips. Then that excess of flakes or this dandruff will be removed off, the scalp will get clean. So unless and until I'm not getting my patient with the clean scalp, I'm not advising my patient to apply any of the oils and other things. So this is the most important thing what I I experienced in my practice. Okay, whenever your patient is coming with the hair fall or dandruff, please do not advise them with any these oils and other things that may aggravate the conditions. So see that the scalp is very well cleaned, and it should get free from these flakes and everything. So till the time he gets cleared with the clean scalp, I keep on advising the patient to use this one for whatever the time it may require. Okay, and once the patient feel that, even after stopping the use of that particular lotion or particular shampoo, if he is not developing this dandruff or flakes or dryness, then I will not advise any of the application. So afterwards, I go with the application. So these are the very simple, yuktis or logics that should be, observed in our patient, and accordingly we should. So what, as per your question, I generally go with the Scurfol lotion or some of the herbal medicine which are available at our college OPD counter.
Thank you, ma'am, for the discussion. Now I request Dr. P.B. Joshi, sir, Professor and HOD of Department of KAYACHIKITSA, for vote of thanks.
Hello. Hello, sir.
Okay. Okay.
Over to you, sir.
Is it audible?
Yes,
Okay. Good afternoon to all. As a part of the webinar series, Kaya Chintana 2021, today Dr. Yasmeen A. Phaniband, Madam, Professor, Department of KAYACHIKITSA, DGM Ayurveda Medical College, Gadag, Madam shared their knowledge with us in the field of clinical approach to Khalithya and Ayurvedic perspective. So, Madam told in detail about that Khalithya, starting from the classical things, and even shared their clinical experiences also. I'm sure that our UG and PG students will be benefited. No doubt, even that practitioners also be benefited by Madam's presentation. It is. So, on the behalf of Department of KAYACHIKITSA, our principal and our management, I'm very much thankful to Dr. Yasmeen Phaniband, Madam, for giving their valuable time to us. Thank you, Madam. Thank you very much. So then I'm thankful to our principal and management for their kind cooperation and support in conducting this webinar. Then I'm thankful to UG and PG students for their kind cooperation and their active participation also. Thank you one and all. Thank you very much.
Thank you. Thank you.
Thank you, sir. Once again, thank you, ma'am, for your wonderful presentation and everyone for your participation. Now I will end the session.
Thank you.